So good morning, everyone, and welcome back. I wanted to start off by updating our numbers today. So since the last time we talked, 1,061 more Philadelphians have been diagnosed with COVID. The previous week, September 1st through the 8th, there were 1,600 Philadelphians who were diagnosed with COVID. So as of yesterday, we're seeing an average of 250 new cases per day, which is down from a high of 313 per day, which we saw on September 4th. Only about 4% of the test results we're receiving are positive, which is a good sign that we're catching most of the virus that's circulating. In terms of vaccinations, yesterday we reported more than 1,025,296 Philadelphians who have received at least one dose of COVID vaccine. That's 82.6% of adults. And 841,821 Philadelphians are now fully vaccinated, which is 67.8% of adults. Yesterday, we reported that 45,349 teens between 12 and 17 have received at least one dose, showing steady progress there. I want to announce a new data set that we're making available starting today. Data on breakthrough cases, hospitalizations, and deaths. But first, I want to explain a bit about what a breakthrough case is, what we interpret these data to mean, and what it means for you. So vaccine breakthroughs mean that a disease has broken through the protection given by the vaccine to some degree. It's important to note that all vaccines have breakthrough cases. This is not just a COVID vaccine thing. So we expect to see some people who have been fully vaccinated test positive. And some number of those people even end up in the hospital, and an even smaller number of them dying. But because we have this data, we know that less than 5% of all cases in COVID in Philadelphia since January have been among people who are fully vaccinated, which means that 95% of people who tested positive weren't vaccinated. Only 3.5% of all the people who've been sick enough to go to the hospital for COVID were fully vaccinated. Or put another way, 96.5% of people who've been hospitalized for COVID in Philly weren't vaccinated. And 98.2% of the 1,184 Philadelphians who have died from COVID this year were not vaccinated. These vaccines work. The data that's going up on our dashboard today will show the month-by-month breakdown of how many cases and hospitalizations happened each month this year, and how many of them were in people who were vaccinated. And every month, the vast majority of those testing positive, being hospitalized, and dying weren't vaccinated. Another interesting thing to note from these data is that the overall number of cases, hospitalizations, and deaths has really dropped as more and more of us have gotten vaccinated. I believe that our high vaccine rate is why we're not seeing all of the cases, the overfilled hospitals, and the deaths that other states with lower vaccine rates are seeing. Again, these vaccines work. You're going to hear some people say that these data mean the COVID vaccine doesn't work. It's not true, and it would be a misunderstanding of the data. So let's walk through why that is. Imagine a group of people of whom 80% are vaccinated. I'm going to choose round numbers to make this easy. If the vaccine were ineffective, we would expect 80% of hospitalizations to also be among vaccinated people. But if, as we're seeing in national studies, the risk of hospitalization is about 10 times higher among people who are unvaccinated as among those who are vaccinated, we would see about 2.5 times as many hospitalizations among unvaccinated people as among vaccinated people. So that accounts for 10 times the risk, even when the vaccinated group is 4 times larger than the unvaccinated group. So the 80% vaccinated, 20% unvaccinated. So for example, here in Philly in August, a total of 343 people were hospitalized because of COVID. 66 of them had been fully vaccinated, 277 had not. So that means that about 80% of hospitalizations were among those not yet fully vaccinated, while only about 20% of the hospitalizations were among the roughly 80% of Philadelphians who were vaccinated at the time. The math works, and so do the vaccines. By getting fully vaccinated, you're not only lowering your chances of having severe COVID, but you're also lowering the risk to everyone who's around you. Being vaccinated is the best way to protect your loved ones, including and especially children who can't get vaccinated yet. Speaking of children, you may have heard that we're starting to see children in schools test positive for COVID. Our team is in contact with the school district, the archdiocese, charter, and private schools throughout the city to see if anyone tests positive and then working with them to quarantine the right people. In most cases, that's just a few people. In other cases, where there are more people testing positive, it could be an entire grade or even an entire school that needs to pause in-person learning. The best way to avoid that situation is to layer on as many protections as we can. With everyone who's eligible being vaccinated, masks on throughout the school day, hand hygiene, and contact tracing, and parents cooperating with isolation and quarantine, we can slow down the spread of the virus and we can keep our schools open. But that takes a partnership across the city. It takes every parent making sure that they and any children 12 and over get their vaccines and get them now. And it takes parents letting school nurses know if their child tests positive and following the instructions their school nurse gives them. So as always, if you would like more information, including being able to see our newest data set on breakthroughs, please visit our website at phila.gov/COVID. If you have questions, please call our COVID call center at 215-685-5488. Thank you.